Hello and welcome to the Fraser Health Online On the Road to Diabetes Health Self-Management Education Series. My name is Melanie and I'm a registered nurse and certified diabetes educator. This is the first video of a 3-week series. Each session has 2 parts. Each week, the first session will be taught by a nurse and the second section will be taught by the dietitian. You will need access to the On the Road to Diabetes Health booklet that is available online, as we'll refer to this during the video. You will also need a pen and paper to make notes of any questions you may have during the presentation so that we can discuss this further during our follow-up with you. I encourage you to complete the videos in order, as each session builds on what was discussed the previous session. In the On the Road booklet, you will find practical suggestions and tips for managing diabetes. Keep it in front of you as you may want to highlight information that is important to you. Today, we will discuss the following points. We'll talk a little bit about emotions and feelings. We'll discuss what is diabetes. We'll talk about the symptoms of diabetes and what do the numbers mean. We'll also talk about self-management tools in order to help you manage your diabetes. And there may be a little bit of homework. Okay, so let's talk a little bit about emotions and diabetes. How did you first feel when you found out you had diabetes? Do you relate to any of the feelings listed in this chart? These are actually the stages of grief, and we can experience these with all sorts of life events, especially change. Being diagnosed with diabetes may be a big change in your life. Our responses are usually affected by our previous life experiences and sometimes our perception of what the diagnosis itself means. The first stage is denial, and it's a way of processing the initial reaction to our diagnosis. It can be a defense mechanism that buffers the immediate shock in an attempt to avoid the inevitable. The next stage is anger or frustration, and that can occur as there is a recognition that things are different. Bargaining happens when we are seeking a way out. We may ask, what if? It sometimes provides an escape from the discomfort, providing some hope and giving a person time to adjust to the reality of the situation. Another stage is depression. People may feel sad, have decreased appetite, loss of motivation, low energy, or just generally feel overwhelmed. Often people go back and forth between anger, depression, and bargaining for a period of time. When we reach acceptance is when we find our way forward again. We're embracing new options and have hope. Some people get stuck and need a bit of extra support to make the adjustment, and that's okay. Talk to your diabetes nurse or your doctor if you're having difficulty adjusting. Glucose, your body's fuel. Glucose is a type of sugar your body uses for fuel. Our fuel comes from a group of food called carbohydrates. This food is broken down into sugar in our stomach as it is digested. It is then absorbed into our bloodstream. The blood vessels act as a highway carrying this fuel to all of our cells. Insulin is a hormone made in the pancreas. It acts like a key to open the cell doors so glucose can enter and be used for energy or kept in the cells to use later. Every cell in your body needs glucose to do its particular work. So to review, carbohydrates break down into glucose, otherwise known as sugar, and this moves from our stomach to our blood vessels. Some of this fuel is used immediately, and some will be stored in our liver or muscles for later use. This can be either when there has been long periods between meals or maybe overnight. Insulin is the hormone that moves the glucose into our cells. Diabetes equals too much glucose in the blood. Why? The condition of type 2 diabetes occurs when your insulin does not work properly due to insulin resistance. This is when the door to the cells is blocked so insulin and glucose cannot get in. Your body also does not make enough insulin, and sometimes your liver releases too much stored sugar. 90% of people with diabetes have type 2. People with type 1 diabetes cannot produce any of their own insulin. This is usually developed in childhood, but can also happen as an adult. Symptoms of diabetes. Many people will not have any symptoms of diabetes. When the sugar level rises above a certain point, though, the body tries to pass the sugar through the urine. This increased urination means increased water loss and thus dehydration. This leads to increased thirst. You may also feel tired or lethargic as a result of not being able to use the energy from the food you eat. Infections are often more common, as well as delayed healing. You can experience changes in vision, commonly blurred, or numbness and tingling experienced in hands or feet as a result of the impact of the high sugar levels on your nerves. What do the lab numbers mean? Because symptoms generally occur with blood glucose levels over 12, many people feel nothing when diagnosed and may even question if the diagnosis is true. How do we know you have diabetes? What do the numbers mean? The criteria for being diagnosed as having diabetes in Canada are listed here. If the values are higher than normal, but not yet at the diabetes level, then the person is said to have pre-diabetes. These people may be able to delay or avoid diabetes if they make necessary lifestyle changes like exercise or weight loss. Once you have diabetes, it cannot be cured, but it can be well controlled. Keeping blood sugar as close to possible as normal is the key to staying healthy. Target blood glucose levels. If we are testing our blood sugars with a glucometer, we are looking at two different tests. You should test before meals or 2 hours after a meal. At 2 hours after a meal, we are looking at the peak level of blood sugar once the meal is fully digested. Ideally, the results before a meal should be between 4 and 7 millimoles per liter. At the 2-hour point, it should be between 5 to 10 millimoles. Ideally, we are looking for a 2 to 3 point rise between the two. When we have tests done at the laboratory, we have a test done called the A1C. We're aiming for a result less than 7%. This translates to an average blood glucose level of 8.6 millimoles. Reaching these target levels helps to lower your risk of diabetes complications. So we'll start off by looking at self-management tools. Your new tools for managing diabetes by yourself are blood glucose checks, physical activity, medication, healthy eating, and managing stress. As you learn and practice using these tools, making little changes day by day, you will see what a difference it can make. We suggest starting slow. We cannot change overnight. Your goals of self-management are how to take care of your condition, how to fit these tasks into your normal activities, and how to manage those emotional changes. The first tool we'll look at is managing stress. Stress may make diabetes harder to manage. We know that both emotional or physical stress can cause the body to release extra glucose into our blood. Types of emotional stress could be moving, changing jobs, financial issues, divorce, etc. Physical stresses could be surgery, an infection, or even a cold. Be aware of what stresses you have. and learn ways to manage stress. What ways do you manage stress? Some suggestions we have for managing stress would be to be more active, to learn to plan, recognizing and accepting limits, making more time for relaxation or developing a meditation routine, talking out your problems with a supportive friend, having fun and laughing. Ensure you're sleeping well and eating healthy. Maybe we need to learn that it's okay to say no or ask others for help. Having hobbies is a great way to manage stress. Perhaps try one, and if that doesn't work, try another. Hopefully you'll be able to find what works best for you. The next tool we'll discuss is physical activity. Physical activity, page 28 and 29. Physical activity helps lower blood sugar levels. Our body does get comfortable with our usual activity, but it tends to give us the energy to do what we need to do and a little extra energy to do what we like to do. Believe it or not, it is possible to feel better as we get older. There are 3 types of physical activity: aerobic, resistance, and flexibility and stretching. There are different benefits from all 3 types. Generally, it's best to do activity 1 to 2 hours after a meal, as this helps to lower your post-meal glucose level. Try to blend in simple activity when you're able, such as using stairs versus an elevator. Listen to your body and stop if you're having any pain or shortness of breath. Remember that exercise helps lower blood glucose for up to 24 hours and longer if it's resistance exercise. So we'll first look at aerobic activities. This would include brisk walking, cycling, swimming, water aerobics, dancing, chair exercises, anything that gets your heart rate up. It's important to try and exercise regularly. Every day or every other day is best. Try to aim for 20 to 30 minutes each time, with no more than 2 days break. This will help improve the cardiovascular system and make your heart and lungs stronger. This is linked to longevity. Currently, Diabetes Canada recommends 150 minutes of moderate intensity activity per week. Resistance activities are recommended 3 times a week. Some examples are light weights, fitness machines, or stretchy bands. It's important to start slow and build up tolerance. If you go too hard too fast, you may experience a lot of muscle pain. This type of activity has the most impact on your blood glucose and on promoting weight loss. Flexibility activities help you move easily, keep your muscles relaxed and your joints mobile. Hold stretches for 20 to 30 seconds. Some examples are gentle reaching or bending, yoga, tai chi, or even just static stretching. Activity precautions. If you're over 40 and inactive, consult your physician before starting vigorous activity. It's safe for most people to do moderate activity, however. Stop any activity if you experience chest pain, feeling faint, any nausea or heartburn, or if you have signs of a low blood sugar, foot trauma, or any other unusual pain. Our next tool is medication. There are many different types of diabetes medication. They have different actions, meaning that they act on your body in different ways in order to help manage your blood sugar levels. They can be combined to control your diabetes, so we may find that we require more than one type of diabetes medicine to manage our blood sugars, and sometimes insulin may also be required. Let's talk about diabetes medications. Metformin is one of the most commonly used medications for diabetes. Its job is to help the insulin our body makes work properly. It also helps reduce the amount of sugar released by the liver. It's generally taken with meals in order to help reduce the amount of side effects experienced. Side effects can be upset stomach, gas, bloating, diarrhea. This is usually reduced by starting with a low dose and titrating up. Side effects usually resolve within the first couple of weeks. The second kind of medication used helps us to produce more insulin. These medications should be taken with meals, and there is a risk of experiencing a low blood sugar or hypoglycemia. Januvia, Onglyza, and Tradjenta help your pancreas make more insulin, specifically when you eat. It slows down digestion in the stomach and slows down the increase in blood sugar after eating. It also helps decrease the amount of glucose made by your liver. These medications are usually taken once a day. Glyburide is a medication that helps you make more insulin, but is quite potent. So typically, there is a higher risk of low blood sugar as well as weight gain with this medication. It's important to know how to treat a low blood sugar if you take these medications. There's another type of medication that works on the body differently. It helps to increase the amount of glucose that gets passed out of the body in urine. This might increase the chances of bladder infections and yeast infections. Some people experience some mild weight loss as a result of losing more water taking these medications. It's important to make sure that you're staying hydrated. There's another type of medication that's used to help us make more insulin, decrease the amount of sugar released by the liver, as well as increase fullness and decrease appetite. As a result, some people may lose some weight. This medication is also given as an injection. Insulin is used when lifestyle and pills no longer keep our blood sugar in the target ranges. There are many different kinds of insulin and can be taken at different times of the day. When taking insulin and some types of diabetes medications, your blood sugar may drop below 4. This is called hypoglycemia and requires prompt treatment. It will be discussed in detail in week 2. However, if you're on medications that can cause a low blood sugar, it's important that you get the information as soon as possible. You may review the information in the On the Road to Diabetes Health Handbook, pages 10 to 12. If there's any further concerns, you can contact your pharmacist, doctor, or diabetes nurse for further information. The next tool we'll discuss is blood sugar checks. When we check our blood sugar, it's assisting us with understanding the effects of food, activity, medication, stress, and illness, and how that impacts our blood sugar level. It's identifying patterns, perhaps time of day or after specific meals. It can also detect low blood glucose. Steps to checking your blood sugar. First of all, we will start with clean hands. Washing with basic soap and water or using an alcohol rub is suitable. Just ensure you dry your hands well. You can obtain your glucometer from the pharmacy. The pharmacist should be able to show you how to use the one you choose. The second part will be to prepare the lancing device, otherwise known as a finger poker. It's recommended to change the needle in the lancing device each time. Don't share your lancing device. It's recommended to use the side of the fingertip. Once your lancing device is ready, we're going to get the glucometer strip. The strips are kept in a container that is heat, light, and moisture sensitive, so it's important to keep the strips in the container. When we insert the strip into the glucometer, it should turn the machine on. Most of them will either read apply blood or show a blood drop. At this time, you're ready to poke your finger. One of the most common errors made with testing our blood sugar is not having enough blood for the strip. When you do the poke, make sure that you squeeze and get enough blood before you apply it to the strip. Once you apply the blood, the result will read in a few seconds. We always dispose of used needles in a sharps container. You can get this from the pharmacy as well. So now we'll look at a testing pattern. It's a good idea to write your blood sugars down in a logbook format. This is one example of a testing pattern. In this diagram, they are testing before breakfast and 2 hours after breakfast one day. The next day, they're testing before lunch and 2 hours after lunch. And the following day, they're testing before dinner and 2 hours after dinner. You can see that the after dinner test on Wednesday was above target. I wonder why. Perhaps the meal wasn't balanced well. Maybe their portion of carbohydrates was too big. Maybe they had dessert. If they had dessert, maybe they could try testing after they do exercise to see how much it would decrease. In the future, that may give them information that if they did something similar, they could exercise after the meal to help keep the blood sugar in target. When you have diabetes, you're eligible for a certification process for your glucometer supplies. When you attend the diabetes center, you will get certification, ensuring that you understand how to use your glucometer, when to test, and how to test. You must be registered with Fair Pharmacare to receive any assistance for these supplies. The supplies will be covered similarly to your prescription medication. Most people are required to pay their deductible before they receive any assistance towards their medicines or their glucometer strips. This is a lifetime certifications, and all BC pharmacies can see if you're registered. It's recommended to check with your extended healthcare provider if you have coverage for glucometer and testing supplies. So in summary, type 2 diabetes occurs when too much glucose builds up in the blood due to our insulin not working properly and/or not having enough insulin. The self-management tools we've discussed today help you manage diabetes and restore the balance of glucose in the blood and body cells. Checking our blood sugar levels helps identify what lifestyle changes need to be made. So this completes Class 1 of the nursing section. You now need to watch the video Healthy Eating for Diabetes Class 1.